Assalamu alaikum. Today my lecture with Stronger Together when cross-thinking meets refractive surgery, presented by me, Osama Muhammad, Fellowship of Cornea, Refractive and Advanced Cataract. Agenda style, we divide it into 2 points. Cross-thinking extra when it merged with the refractive surgery such as BRK, LASIK, and SMILE, and which is in suspicious cornea. While cross-thinking plus, it is for keratoconic, early to moderate keratoconic cornea with BRK, BTK, KERS, and phakic IOL. Our aim in this lecture, when we mix cross-thinking with the refractive surgery, to decrease the risk of iatrogenic ectasia. According to John Marshall at 2012, he reported that the LASIK weakened the cornea by 15 to 25%. First, we will start with the extra. In systematic review made in 2020, they found ectasia without identifiable cause per 100,000 for BRK 20 cases, 90 cases for LASIK, and 11 for SMILE. From this result, SMILE is the least one. Actually, it started 5 years before, 5 to 6 years, world begin to start use SMILE. So its report not reflect. The science believe that the BRK, it is the lowest risk of corneal ectasia, because it is once we hit a membrane, it will end with a scar. So when the laser hit the bomal layer, it causes pseudo-bomal layer, which is against ectasia. What is the indication for BRK extra and LASIK extra? If it's the age less than 30, the circle equivalent more than 6, if the suspicious tomo but not keratoconic tomo, residual stromal bed less than 280, and cornea thinner than 480, bad display, bad D more than 1.6, and TBI more than 0.25, and CBI more than 5 in corpus, and positive family history. Any 2 of this parameter, we will go for extra procedure. Regarding the BRK extra, the step epithelial removal and refractive correction, sucking with the special riboflavin, dextran free, use UVA irradiation, and mitomycin for 20 seconds. For the LASIK extra, we will LASIK flap creation and refractive correction, lifting the flap, soaking with the riboflavin, rinsing with the PSS, and repositioning of the flap and UV irradiation. This is study supporting myopic LASIK extra. This is also studies made on myopic BRK extra. Both show that PRK with simultaneous cross-linking has been reported comparable to BRK alone, and all complications are transient and solvable. This is supporting myopic LASIK extra. Also, it is safe and comparable to the LASIK. And one report and also it is with the transient complication. Regarding the hyperopic extra, they use it for to halt ectasia, and second, to decrease regression, since there is high risk of regression after hyperopic treatment. One case in one eye report by Tanri et al. He treat both eye, one eye of them showing ectasia. What is the indication of SMILE extra? The same of BRK and LASIK, but they put 3 or more and add history of eye rubbing to the inclusion criteria. Regarding the steps of SMILE extra, it is standard SMILE protocol, soaking with the riboflavin, rinsing with the stromal PSS, and UV radiation use. SMILE extra, this is study supported, safe and effective with a transient complication, not affecting the final visual outcome. Regarding the corneal extra plus, we use it to mild to moderate keratoconus. First, we have Athens protocol. It is the oldest protocol used. We use BRK less than 50 micron after removal of epithelium. Residual stromal bed should be more than 400. Regarding the enhanced Athens protocol, we use the BRK, then BTK. All are safe and effective, and they show that it is 94% halting the disease progression, although 5% it progressed, and visually significant haze in 5%. Regarding the creatine protocol, we use BTK 50 micron and enlarge it 6.5 to 7 and enlarge it by mechanical by 1 millimeter. Regarding the keratin plus protocol, PTK for 50 micron and maximum PRK 50 micron also, and the stromal bed 350. It is effective and significant improvement in both visual and keratometric. But in the creatine plus protocol, there is 7.3 stromal haze. Regarding the Star X, I just share it from our beloved scientists who live away from us, Dr. Safwan Al-Bayati. Selective transepithelial ablation with simultaneous accelerated cross-linking. We point the zero marker, and then we go to the outside of the cone till we reach 43 diopter. We include in the outer margin of the cone, and here it's Athens water treat, and here's what Star X protocol treat. See, Athens, there is the outer periphery treat 5.5, while Star X it remove all tissue. This is also pre and post in this case. This is Athens treatment, and this is the Star X treatment for regularization of the cornea. Cares and just talk about it in the morning, and check all Dr. Osama Jalidi discuss it. And in conclusion, integration of cross-linking with refractive procedure has expanded scope of the refractive correction previously to unfeasible scenario such as borderline and ectatic cornea. Thank you for attendance.
Great, thanks.